All right, so now we're going to go over the precautions and contraindications for using hot and cold therapy. For doing heat, I would ask if the patient had any recent injury, edema, or swelling. If it's a female, I'd ask if she was pregnant. I'd also ask if there was any impaired circulation, any cardiac insufficiency, if there was metal in the treatment area, if it could be taken off, we would do that. I would also ask if there was any open wounds, any topical creams used in the area, and any kind of decreased sensation anywhere in the body. Those would be precautions. The contraindications that we would not treat the patient would be, so I would ask the patient, do you have any recent hemorrhage or bleeding?
No.
Any recent blood clots?
No.
Any decreased sensation in the area of treatment?
No.
Any recent issue with decreased mental status?
No.
Any recent or current cancer?
Not that I know of.
Okay. And if he answered yes to any of those questions, we would not go forward with treatment. For cold, the precautions is we would not treat over the superficial branches or nerves. We would not treat over an open wound. Also high blood pressure, any kind of decreased sensation, also decreased mental status, and then if it was a young or elderly population or patient, we would move forward with precautions. The contraindications for using cold therapy are, do you have any cold hypersensitivity in the area of treatment?
No.
Any cold intolerance in the area of treatment?
No.
And do you have a disorder known as cryoglobulinemia?
Not that I know of.
Okay. Any cold hemoglobinuria?
Not that I know of.
And do you have a disease known as the Raynaud's disease?
Not that I know of.
As far as the peripheral nerves go, do you have any kind of recent injuries going on in peripheral nerves?
No.
And do you have any peripheral vascular diseases?
No.
Okay. And again, if he answered yes to any of these questions, we would then not go forward with treatment.